To the pandemic, health officials are expressing more concerns with dwindling vaccination rates. Joining us live to discuss vaccine hesitancy is Dr. Monica Gandhi. Dr. Gandhi is a physician and professor of medicine at the University of California in San Francisco. Doctor, thanks for joining us.
Thank you.
We are now more than a year and a half into this pandemic. A vaccine has been developed, but we are still seeing hesitancy to get the shot. Are we past the point of trying to convince people to take this vaccine?
You know, I think we may be. So lots of efforts to convince people, lots of education, safety, and effectiveness. There was also a lot of attempts to do community mobilization, get the shots to where people were, mobile vans, pharmacies, doctors' offices after the mass vaccination sites. So there was a lot of work done after April 19th when the shots were available to everyone. And now with President Biden's last announcement, he is, and his administration is turning more towards attempts of vaccine mandates and vaccine passports.
How would you persuade people to get the vaccine? You just mentioned that we may be past this point, but if you had someone sitting in front of you, how would you tell them you need to get this done?
You know, I would tell them that it seems ostensibly like it took a really quick time to develop these, but we actually had the vaccine technology, even this specific mRNA technology, for 10 years. We also have put a lot of money into the problem and had a lot of COVID going on, so those vaccine trials could be done quickly. We have given out 5.4 billion doses across the world and have very good safety and effectiveness data for these vaccines. So try not to believe sort of what you see, because there can be a lot of misinformation about these vaccines. They're safe and effective. They're absolutely saving lives. I'm a physician who sees people in the hospital. I'm an infectious disease physician, and it's the unvaccinated during this later surge that are most at risk for being hospitalized.
Doctor, for months, most of us have hoped to see the light at the end of this pandemic tunnel. I asked this question to a guest last night here on Prime. Is COVID now a part of our lives? Is it here to stay?
Yes, I don't actually think we're going to eliminate or eradicate it in the strict infectious disease definitions of those two terms, which means zero cases. This is what I think is going to happen, though. We can get to a level of control. What does control mean in infectious disease? It means a infection is endemic, it's around, but it doesn't cause the damage or the societal disruptions that it has up to this point if we could get higher levels of vaccination. Good example, Denmark, Switzerland, UK, Ireland, all fully opening up with high rates of vaccination, accepting the endemicity of the virus, ensuring that those who are vulnerable get vaccinated so that people are kept out of the hospital, doing as much screening as they can, but living with it.